Hi, good morning Franklin. My name is Mihiraa. I'm your invigilator for the OET-speaking session on the 8th of April 2022. How are you doing? Well, I'm great. Can you tell me your full name for the record, please? And what is your candidate number, please? Thank you. And you are taking this test as a nurse? Is that correct? Thank you. Can I see your ID, please? Thank you. So let's start with warm-up questions. The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes. What do you find the best part of being a nurse? How well can you cope with the advances in medicine? What are some of the most important things to consider in the nursing position? How would you work with the charge nurse? How do you handle unexpected circumstances like short staffing, unfamiliar treatments, etc.? Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions? You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role-playing card if you want to. Here's a pencil for making notes. You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up. Good morning, Franklin. I am good. Thank you for asking. How about you? Nurse, it is too early for me to get discharged. I am very much concerned about my care and support after discharge. Nurse, I have a granddaughter with me, and have got a good neighborhood as well. But, when they leave for college and work, I will be alone. Well, nurse, I am really afraid of walking around independently, and especially of falling over in the shower. I am not prepared to be discharged, nurse. But, will that be enough? All right, nurse. By the way, what about my medications, especially for pain relief? Okay. Nurse, I am also worried about looking after the surgical wound area. Good to hear that, nurse. All right, nurse. I understand that. Thank you for your consideration. In terms of follow-up care, when is it appropriate to make an appointment? All right, you may please. Okay, nurse. All right, I got it. Okay. Yes, nurse, I will. Also, how long will it take to heal? All right, nurse. I understand that. I will take care of it. Thank you, nurse. Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.